Are you continually making the same mistakes, doing things like sciatic flossing, doing knee hugs, doing pelvic tucks, trying to solve your lower back pain and wondering why it's not working, why it's not getting any lasting relief beyond maybe a couple of minutes or maybe 20 minutes, half an hour? The reason being is that you are providing more flexion in all of these exercises. Take stock and think about it. Flexion through that lumbar spine, rounding of the lower back, trying to decompress the back, when in actual fact you're not decompressing anything. You're just stretching out these structures that unfortunately in most cases of lower back pain have been stretched out too much anyway, which is why they failed in the first place. You invariably did not injure your lower back arching backwards in any sort of direction. It was bending forwards or in a rounded position when you went to get up out of a chair, when you went to put your socks on. It's those sorts of activities that led to back pain. So doing more of the same is not going to fix your back. And now hopefully the penny has dropped, because just like all of our members in the Back in Shape program, they've been doing the same exercises just like you and getting nowhere. You feel like a little hamster on a hamster wheel. It's not addressing the cause of the problem here. It's just trying to put a 20-minute plaster on the back. And that can really leave you into a little bit of trouble. Now, you can learn more about our program by clicking the link underneath here. But just to give you a little bit of help inside this video right now, you need to understand that your lower back becomes injured in these flex positions. We spend inordinate amounts of time every single day sat down rounding through here. So whether it's a disc injury, a prolapse disc, a herniated disc, or whether it's some sort of reaction down in the lower body like piriformis syndrome or some sort of type sciatica type symptoms, they are stemming from an injury in this section of the lumbar spine. Typically L4-5 and L5-S1 are the root causes of the problem. And by continuing to put more pressure through those with these sorts of ineffective exercises that I mentioned at the start of this video, you're just stopping yourself healing. And the big thing with back pain is the longer it goes on, and the longer it goes on without a fix or without some sort of proper remedy that provides lasting solutions, the worse it tends to get, and it starts to slip from an acute problem into a chronic problem. And when it's chronic, we have to start to learn to move our body again properly. We have to start to relearn and unlearn some of the things that we've done in the past so we can more effectively start to provide stability to this part of the spine. Because the thing that works when it comes to fixing back pain is learning to provide stability to this spine and then building up from there. Sure, we want to do some work to our hips, and there's plenty of information about how we do this without making mistakes inside the link below, where you'll learn more about the Back in Shape program and how you can get started with a free trial. Seriously, what have you got to lose? If you've been going around looking on YouTube to try and help you, you should definitely have a look at the link below. See you soon.